An estimated 86,000 diabetics have their feet amputated yearly.
It is the leading cause of non-accidental foot amputations. Medical Watch reporter Seema Mather tells us about the problem diabetics should not ignore.
Well, because of lack of feeling and poor circulation, many diabetics don't realize how quickly a little wound can progress. That's what happened to Austinite Clay George. It's the focus of tonight's Medical Watch report.
And that's leaving.
Riding and roping horses is what makes Clay George feel alive.
When that horse leaves, it's an adrenaline rush.
Clay has been riding since he was a child, so when he learned he was at risk of foot amputation, it was terrifying.
He neglected to take care of it, and because of that, the infection is tracked into the bone.
Dr. Kevin Myer says Clay's biggest mistake was treating his wound himself.
I'd bandage it up, and like I said, it never hurt.
How you doing, Mr. George?
Fine.
Clay is like many diabetics. His prolonged high glucose level caused nerve damage in his feet, which means he couldn't feel how bad his wound was.
We grow up thinking that, whenever you don't have pain, you don't have a problem.
Clay had to undergo detailed wound care and surgery. He lost his big toe, but most of his foot was saved.
If I'd have come in 3 months, 4 months before this, I probably wouldn't have lost anything.
Most likely, Mr. George will probably have to go into some type of prosthetic shoe.
When Clay's cast comes off, Dr. Myer expects Clay will be able to ride again. Clay says he's learned his lesson.
I wasn't even going to do my own toenails anymore. I mean, if there's anything wrong, I'm going to the doctor.
And Dr. Myer says that's not overreacting. Even an ingrown toenail can lead to an amputation in a diabetic if they don't get medical attention.
And Dr. Myer says if you are diabetic, you should inspect your feet daily. Keep your feet clean, always wear shoes, even if you are inside, and get regular foot exams. And as we learned with Clay, a small ulcer can progress very quickly.
Very quickly. Thank you, Seema.
Thanks.